Hey guys, Dr. Ruth Roberts here. Hope you all are having a great day. We've been getting a bunch of questions about canine influenza, and it's a really complex subject, unfortunately. But unfortunately, as the saying goes, it's a vaccine in search of a disease, and that's not quite entirely true. But here's what I can tell you. So we're in South Carolina. And actually, Lisa posed this question about the flu, as well as another friend and client, Debbie Zimmerman. So we've gotten reports that there's been a flu outbreak in the southeast, and the first reported cases were at the end of May in Florida, and there's been reported cases currently in South Carolina and North Carolina. And the thought is that folks went down to a dog show in Perry, Georgia, and brought home a gift that keeps on giving, so to speak. So here's what I can tell you about the flu. Yes, it can be deadly in 1 to 5% of the cases. The vast majority of pets that get it, though, are, they have this symptoms similar to us. Most commonly, it's a cough. They don't feel great. Runny nose, that kind of stuff. Where deaths have occurred really happened at the second outbreak, although it's the first major nationwide one in 2011. And the flu just got into groups of racing greyhounds in Chicago and Florida. So there are 2 huge dog tracks there. And they are kept in close quarters that are questionable as to their sanitation, so to speak, and that's where the deaths occur. Very, very rarely in older or debilitated dogs. There are some dogs that have died. So far with this outbreak, there have been no deaths, which is awesome. And these guys, they don't feel good. So it's kind of like us with the flu. You just feel cruddy, and there's not really much to do about it. Tamiflu and those sorts of antiviral medications have not been effective. And so what are you supposed to do? The reason I said at the start of this episode that it's a vaccine in search of a disease, is that the epidemic currently is 12 cases in Florida. Wow. Okay, so we need to now vaccinate every dog in North America with a vaccine that has potential health risks, because there are 12 dogs that have gotten sick. And granted, there are more than that currently, but this is what I would like you to consider. I'm going to read you the vaccine guidelines from one of the manufacturers, just so you get an idea about the vaccine itself. And so Merck Animal Health and Zoetis have vaccines for the H3N2 canine influenza virus. And 2 doses of vaccine must be given for optimum immune response. The doses are administered over a 2 to 3 week period and establish immunity within 1 to 2 weeks after the second dose. Just like human flu vaccines, the canine flu vaccine may not completely prevent infection, but will make it less likely. Additionally, if a vaccinated dog does get infected, the disease is likely to be mild and of shorter duration. Does that sound really reassuring? Do you really want to give your dog 2 vaccines because it might not get the flu? And we have to go talk to Esau because he's upset about the grass being cut. So here's the deal. Do you want to give your dog 2 doses of a vaccine, which, according to the marketing materials, so far has had no known side effects, because it might not get the flu, and also it may limit the severity of infection? I don't know. The other thing is that it's difficult to find data about the level of protection. The last time I went to a meeting about this vaccine, which was in 2011, if I'm not mistaken, I believe the efficacy level was somewhere around 76%. So that means that 76% of dogs that receive the 2-dose series have some protection against the disease or will experience fewer symptoms. I don't know. So what do you do? So again, there's 2 strains of flu viruses out there. They both seem to be in play currently, which they always are. The number of cases currently is very few. There's actually been a few reported cases of cats developing the flu virus. And so, again, it stinks, but thankfully most of the symptoms are self-limiting. So what happens with this thing? So your dog goes to a boarding kennel, it goes to a dog show, it goes to a dog park, it gets exposed to another dog that goes and expels all these fomites, which is the $10 word I always like to use. Basically, the little virus particles are in the dog's saliva that has now been coughed 20 feet away from it. So 48 hours after exposure, that's when symptoms can develop. And the thing that is a little weird about this is that your dog can actually be contagious to other pets, dogs or cats potentially, not human animals, for 28 days, 4 weeks. So what does that mean? Don't go to the dog park. Don't take your dog to a boarding kennel. Don't take your dog to the vet, because it is still potentially contagious. It's really hard to get one of those surgical masks to fit over a dog's face. So I don't know if you've tried that or not, but it doesn't work out very well. So that's the thing. That's why in hospitals and things, they're now asking people that are ill or that have suppressed immune systems to put those little surgical masks on so you don't get suck up all the germs from all of our friends and neighbors. So that's kind of the deal. It's tough. One of the local veterinarians, is right. One of the local veterinarians put on their website, please don't be offended if we ask to examine your dog with flu symptoms out in the parking lot, because they don't want to bring it inside and potentially infect not only all the patients that are there that day, but also the entire environment within the veterinary hospital. So that's reasonable. Again, it's the flu. The vast majority of symptoms are self-limiting, meaning they're going to feel cruddy for a couple of days and then start to get better. Now, for dogs that have asthma or allergies, respiratory allergies, that sort of stuff, perhaps those dogs are going to be more at risk to develop more severe infection or more severe symptoms. And the severity typically comes if they develop a secondary bacterial infection. So remember, this is a virus. Antibiotics do nothing for viruses. But if your dog develops a secondary bacterial infection, and indeed in 2004, we did have the flu run through here, and I remember several patients that came in with symptoms similar to kennel cough, which is a bacterial infection, but they went on to develop almost a pneumonia, and that's pretty cruddy. And those dogs, if you treat them appropriately with antibiotics and fluids if needed for fever and things of that nature, they recover and do great. So that's where you have to pay attention. If your dog you feel your dog may have some symptoms with flu, they've developed a cough, something of that nature, typical things like Robitussin or other cough suppressants aren't helping, they really feel cruddy, they're not eating, they're not drinking, that is when you need to take your dog to see a vet. But beyond that, most of the time, just give it a day or so. And as long as your dog continues to eat or drink, then all is well. The other thing is that you can get a digital thermometer, and you don't have to stick it up your dog's butt. There's a study that said that under the armpits, you literally take the thermometer, put it under your dog's armpit, and hold it there until it beeps. That's going to be accurate within 1 to 2 degrees. So normal temperature for a dog and a cat is about 1 to 1.5. So if your dog's not feeling great or your cat's not feeling great and the thermometer reads 102, then it's probably worthwhile to actually take a rectal temperature to verify that this may be a fever or maybe it's not, but that's going to give you an answer. And so in that case, use either some lube or vegetable oil or something like that to kind of ease the rectal insertion, kind of and it's uncomfortable, and especially if your dog has been having diarrhea, this is not fun. Go for the armpit method, and if it's high, then really, and your dog's got diarrhea, go to the vet. Anyway, so verify that the temperature is high or not high. If it's high, meaning 102, 103, all these good things, that's when you need to go see your veterinarian and get some help. So that's what I can tell you. Let me check my notes and make sure that I haven't missed anything else. And that's pretty much it. I've got a couple of links I'm going to put in, talking about do we really need to vaccinate our dogs? And I think given the circumstances, probably not. If your dog does agility trials and you go to dog shows or it's boarding frequently, maybe that's a good idea, simply because the risk of exposure is markedly increased. And I know that most of the boarding kennels currently are very aware of what's going on with dog flu, and they are really being careful about allowing different pets to come in. So for right now, until this blows over, avoid the dog park, avoid dog socials. Walking around your neighborhood and sniffing noses, probably okay. But it's the big concentrations of pets that tend to create the issues. Also, I'll put a link in there if your dog does develop flu. Interestingly enough, in the early 1900s, I think it was 1911, when the Spanish flu went through and killed 30% of the people in the world, because it was just, that was a bad news bear. Homeopathic medicine actually produced the greatest cure rate. And so a colleague of mine, Dr. Will Falconer, has a blog post on his site about what treatments might be helpful in combating dog flu. So that's what I know. I am really happy to see all of you guys. Great to see you too, Susan. Do you guys have questions that I haven't answered? Just kind of scrolling through there to make sure. If not, a couple of questions we've been getting off the website and various other places. As far as kidney disease, gosh, I think I talk about this almost every time, but it's a huge problem, and there's a boatload of information and misinformation out there. So, top 5 tenets. Wet food, whether that's cooked, canned, or raw. And I would recommend cooked over everything, of course, with the crock-pot diet. Number 2, probiotics help tremendously. Number 3, fish oil helps tremendously. And what those two things do is improve your pet's level of inflammation so that the kidney is not insulted as often, and it may be able to begin to repair what's been going on. And then, number 3, look at your vet's telling you, oh my gosh, your dog has stage 2 kidney disease, Irish stage 2 kidney disease. How does your dog look? Does it look like nothing? How's your cat look? No big deal? Eating, drinking, everything's beautiful? The numbers are high, and that is cause for concern because we don't want them to progress. Do you need to go on a low-protein diet? Probably not. I don't recommend putting dogs and cats on a low-protein diet for kidney failure until their phosphorus. We're unable to control it any other way, and that includes phosphate binders and everything else. There's a boatload of different supplements out there that are very helpful with kidney disease, quercetin being the biggest bang for your buck. So I talk about this ad nauseum in the kidney health program we have available on the website. The probiotics Susan is asking about once a week or daily, and so that depends on where your pet is. If your pet's been sick for a long time, daily for 30 to 60 days. If your pet's chilling and maintaining and everything's beautiful, then try decreasing to every other day. That's okay after a couple of weeks, kidney values aren't changing. Then try twice a week and then once a week. For normal, healthy pets or pets that have gone through a disease process but they're recovered from it, generally once a week is sufficient. The idea being that when you take probiotics, you're inoculating your gut with the good guys. You're putting the good guys in there to duke it out with the bad guys and to replenish your immune system as well as your ability to produce neurotransmitters. So if you're healthy, everything's beautiful. Gut flora is well established. They've got plenty of good stuff to eat. Once a week is perfect because somewhere between 10 and 14 days after you've taken a dose of probiotics, that is when the gut flora population starts to drop down. So by giving it once a week, then we get things back, we just keep that level, that population way up there doing its work. So that's kind of the short answer to that question. The other question we've been getting is kind of pain relief for pets that have arthritis. What do we do there? Again, crock pet diet, wet food. We've had many pets have tremendous pain relief just getting off of dry food, even though it was great stuff like Origin or Arcana. Moisture is so important. If you don't have enough moisture on board, nothing works well. The other thing is a good broad spectrum joint supplement. I've used Arthritis for many years because it seems to provide the most bang for the buck as far as pain relief. And the other thing that I've been using of late for dogs with arthritis is Canapet. So my dog Esau is 15, and that was him earlier barking and running around and raising almighty Cain. He has done so well with Canapet. We've been able to take him off of tramadol. I still need to use some gabapentin for him. He's still getting acupuncture. He's still getting Arthritis and eating all the good stuff and getting the probiotics and all of that. But I've been able to take an entire medication out of his need list with Canapet. He feels happier. He's starting to play. We gave him a pig ear last week, and he's throwing it up in the air and running around like an idiot. So I'll take that as a yes. That has been fabulous. And we've got several blogs on medical marijuana as well. This has been another subject that's come up. Still not legal in South Carolina, obviously, and maybe it won't be legal in the rest of the U.S. if the Trump administration ends up doing what they said they want to do. But Canapet is made from hemp, and hemp products are legal because it's essentially an agricultural plant. But you still find the medical benefit that you would with medical marijuana. Perhaps not in the same ballpark, but the results that we've seen thus far have been fabulous. So that's what I know about there. You guys got questions? Anything I can answer for you today? Let's see if anything pops up here. Just Susan's questions about probiotics. That is what I know for right now. Keep watching the news about canine influenza, but generally what happens is it shows up, it hangs around for somewhere between a month to 2 months, and then it blows back out of town. So just be cognizant of that. The reporting websites like the AVMA had a map that showed numbers of cases here and there. It's still from September of 16, so that tells you about the severity of the epidemic of canine influenza the Southeast is experiencing. All right, thanks guys. Really appreciate you showing up. And remember, your pets, yes, Canapet is the name of the company, and I'll put a link down there for you, Lisa. Remember, your pet's best health starts in the bowl. Take good care and see you next week.